Years or so, Mal has developed a keen interest in infectious disease, which has led him to have quite an involvement with Lyme patients. Mal's recent interest has been in psychiatric conditions experienced by Lyme patients and the associated role of infectious disease. Mal will share his thoughts.
Thanks very much, Dean. Sue, do you remember now when I did this last time? I'm not going to do the rap version this time. As Dean said, I've got a very passionate interest in the infectious disease side of things, and particularly the psychiatric manifestations that are causing a lot of grief to a lot of people, particularly a lot of patients, and causing a lot of misdiagnosis to a lot of unfortunate patients that end up in places like this behind me, i.e. a hospital. So I'm going to tell you about a term that I call Patho-Psychiatry, which is often called neuropsychiatry by a lot of health professionals, but I personally don't like that term because neuropsychiatry implies that the nervous system is actually what's causing the problems, but in my opinion it's actually the pathogens that these Lyme patients have that are actually causing the problem. I'm going to also talk to you about a concept called conversion disorder, which a lot of people will have heard of, especially lately. A lot of people who are in the Lyme forums have heard a lot of grief about this. A lot of patients that are very sick end up in places like behind me, the hospital, and end up getting diagnosis of something called conversion disorder. So I'm going to tell you about that. The background behind it is there's been a lot of talk about this on privately and individually, and I've seen a lot of patients suffering badly because of the psychiatric symptoms they undergo because of their disease, which is very, very sad. A lot of depression, a lot of anxiety, suicidal tendencies, and very sadly a lot of suicides as well. When I say a lot, any more than zero is too many, of course. So I want to clear the air a bit about it and what it means and what my view is on it. So first of all, Patho-Psychiatry, well, what is it? First of all, it's a term that I made up, so you may not have heard it before, so I'll forgive you if you haven't. But what I'm referring to is the psychiatric conditions that are caused by pathogenic disease. Okay? So when we say pathogenic disease, we mean infectious disease. In this case, we're talking about borreliosis or Lyme, depending on which term you like to use. Infectious disease is simple as a common cold, is pathogenic disease, causes the cold. Now, when I talk about psychiatric conditions, I'm talking about things like depression, anxiety, paranoia, delusion, schizophrenia, severe mood swings. These are all symptoms that almost every Lyme patient that I've ever spoken to experiences in one form or another. As I say, call it what you will, call it neuropsychiatry, patho-psychiatry. It's the concept that's important. And I want to differentiate too between mild symptoms and severe symptoms. So obviously somebody who's got chronic disease of some kind is going to experience some level of depression because they've been sick for 10 years or whatever it is. I'm talking about the difference between that kind of depression and disproportionate psychiatric response. So people who experience severe mood swings and anxiety and whatnot that are not proportionate to their circumstances. And I've seen a lot of this, spoken to a lot of people in private about it, and it's a very severe and significant situation. The far majority of Lyme patients I've met experience more than one of these symptoms. The key point though is that these are not the cause of the disease. They are not the cause of the disease, they are symptoms of the disease, and this is where the big problem is happening. They are manifestations of the infectious disease process that's going on inside the person's body. So to be clear, a symptom is something that results from the disease process. It is not the cause. Contrary to what some people would tell you, this is actually not a new concept. It's a well-documented phenomenon. Far back as 1896, Scientific American magazine talked about something called toxoplasmosis. Now, if you don't know what toxoplasmosis is, it's a parasitic infection by a parasite called Toxoplasma gondii. And in the immunocompromised person, this will cause psychiatric conditions. That's very well documented. So it's not a new concept. Unfortunately, though, it's still having a lot of trouble getting it recognised. A lot of you people will be aware of someone called Dr. Horowitz, who's a member of ILADS. He talks a lot about this in one of his latest books, and he says, and I quote, "Virtually every psychiatric diagnosis listed in the Diagnostic and Statistical Manual, also called the DSM, which is the Bible of mental health disease, can be caused by Lyme disease and co-infections. It's a very significant statement. Dr. Robert Bransfield, who's a psychiatrist who specialises in Lyme, and I like him because he's a psychiatrist, he's on our team, and he says, and I quote, "There are thousands of peer-reviewed journal articles demonstrating the causal association between infection and mental illness." He also says there are 240 peer-reviewed scientific articles that demonstrate, again, the causal association between Lyme and tick-borne disease and mental illness. So without bogging down on the technical details, the actual reason this happens appears to be because of a number of things such as cytokine production in the brain, the effects on the nervous system, direct infestation of the microorganisms in the brain and the neurons, neurotoxins in the brain, and the damaged blood-brain barrier. So let me introduce you to this concept called conversion disorder. A lot of people have heard about this, unfortunately all for the wrong reasons. The theory behind conversion disorder is that the physiological symptoms that a patient suffers are caused by, and I repeat, are caused by psychiatric conditions. So these patients that present to hospitals such as that behind me with burning sensations, muscle and joint pain, coughs, twitches, spasms, seizures, and 30 other symptoms that you get that are physiological, and they might present with a little few psychiatric conditions, they end up getting diagnosed with this thing called conversion disorder. So, what they're saying basically is that the physiological symptoms are caused by the psychiatric conditions that the patient's experiencing, okay? But it's actually not, it's the other way around. In fact, I think it's very unlikely that anything such as conversion disorder actually exists. My current opinion is that conversion disorder is a misdiagnosis, and I believe that all these patients have chronic infectious disease of some kind. It's a diagnosis by exclusion, when apparently there is no other cause or explanation, which in my opinion is incorrect. The Merck manual, which is basically the Bible that the doctors use, says under the heading of conversion disorder that symptoms develop abruptly and the onset is usually linked to a stressful event. Now, my very good friend Mandy, who is a Lyme patient, has given me permission to talk about her case, who's in hospital up till yesterday. She has physiological symptoms that I've never seen before in my life. Physiological down to the point where she has oxygen concentration stats drop down to 70%, a heart rate that fluctuates between 50 and 160 for no reason whatsoever. Terrible seizures, often followed by amnesia and comas. She gets rashes and many other physiological symptoms, has multiple pathology results that strongly suggest infectious disease, yet she still gets the diagnosis of conversion disorder. Now, I was in hospital with her once, and I had 5 doctors around me, including a head neurologist, and the poor girl was under plenty of stress, sitting next to me in a wheelchair in tears, while the head neurologist told her that she had conversion disorder. And by the Merck manual's own definition, because of the stress that she was under, she should have gone into seizure. But no, she didn't. She was in tears, I can tell you that. And I was in a bit of rage myself, hearing what they were saying. Then the next day, it was a beautiful sunny day, the stress had all passed, we were outside talking and laughing, and guess what? She had a seizure. So it wasn't preempted by a stressful event. So enter the concept of differential diagnosis. So this is what's happening, is that the differential diagnosis is not happening to these patients. Differential diagnosis is when the medical fraternity or the doctors treating look at the patient and assess every single symptom that they are undergoing, psychiatric or physiological, and come up with the most honest, best explanation with that for that person's symptoms, and use that as a diagnosis. And that's just basically what's not happening. These patients are suffering infectious disease. So I've got 3 messages that I want to put out there. The first message is to the patients. First of all, you have my deepest sympathies for what you're going through. I've seen it, I've heard it, and I've seen what it does to people's lives, these kind of conditions. What I just did is to try and understand this concept of patho-psychiatry or neuropsychiatry, call it what you will. Feel free to talk to me about it, because I've spent a lot of time thinking about this. And if you know it, as they say, knowledge is power, and in the case of this, the power is to help you deal with it yourselves. My second message is to the carers out there. If you can also learn it, it will help you understand the patient that you're working with and that you're caring for. But my third message, and the most important message, is to the medical fraternity. Please, please, please learn this concept. It is really important. It is really important.